You see it with people, we see it with animals. People who are in chronic pain, they're just more reactive, they're tense, they're on edge. The same thing happens with our veterinary patients as well.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Tasha McNerney, thanks for joining us today.
Thank you so much for having me.
So we want to speak to you as a specialist, a vet tech specialist in pain management. Can you tell me a little bit about that training and what it entails and what you know?
Yeah. Oh man, what I know might be, we could go on a big tangent there.
You know,
specifically training-wise, I am trained as a certified veterinary technician, and then, working in the clinic all the time, I got put into surgery because I was really interested in surgery in general. But then I became very interested in how do we manage the pain from surgery. And as I kind of got more interested in acute pain management, chronic pain management, and all facets of pain management, I discovered there was this extra certification that you can get as a veterinary professional, and that's called, you can become a certified veterinary pain practitioner. It's a designation given out by the International Veterinary Academy of Pain Management. It's about a 2-year program that you go through. There's a bunch of checklists. There's an additional training that you go through. So you're kind of studying everything from, again, very acute pain all the way to long-term chronic pain and then end-of-life care pain. So really it runs the gamut, the training for this. And I just was fascinated by all the ways that we can help prevent pain in our patients. And not only from a pharmacologic perspective, right, with drugs, but there are all kinds of physical modalities that we can do. There are kind of supplements and treatments that we can use. So it's not all about just one throwing opioids at our patients. It's really about kind of nuanced, how can we prevent pain in the best way possible? And I think one of the newer things that I'm getting into, and it's very fascinating, is this kind of idea that pain and pain perception is very tied to the psychological experience that the animal has. And so I think that some of those things are very interesting as well, right? Making sure that we prevent fear, anxiety, and stress in our patients, because those things are going to exacerbate pain signals. So just pain in general is really a fascinating topic. And then how we treat it, again, whether it be acute or chronic, is very cool as well.
That's really fat. There's a lot. I want to have you come back just to talk about how the emotional experience that a dog is in would exacerbate their pain, because that is something Dr. Dressler has talked about for years, that we should be boosting life quality and reducing stress and pain in our animals, especially dogs with cancer, because that will actually help to relieve all of the symptoms of the cancer diagnosis that they're going
100%.
through.
Yes, 100%.
Will you come back and talk about that?
Oh, certainly. Yeah. It's it's really, really cool. I mean, I think we all know that, if we have something going on, things like meditation and yoga, right? They play such a big role, but how can you tell your 9-year-old boxer to come do some yoga, right? It's not going to happen. But there are other ways that we can, benefit the emotional kind of psyche of our canine friends, and that's just going to help them.
I love it. Well, okay. Well, today I want to talk about post-surgical pain management, because so many people whose dogs have cancer either have just gotten back from an emergency surgery to remove a bleeding tumor, or they're planning for some sort of a surgery to remove a tumor or get a biopsy. So I would love to hear your tips and tricks about how to make sure that after the surgery is over, what can they do at home? For example, I know a lot of people don't want to give pain meds because they have they worry that giving too many medications is going to harm their dog. And it seems like their dog's feeling fine, so they don't think they need to give the pain meds. Is that something that could you weigh in on that as a pain specialist?
Yeah. So we do see that a lot. And so commonly when I do recheck phone calls for people and I ask them about the pain control, one of the more common things I hear is, we stopped giving that because he seemed like he was back to normal. And, Yes, I do think that you guys are going to know your dog's best. And if you really feel like he's back to normal, then maybe we could talk about reducing the amount of days he's on postoperative pain control. But we don't want to just go no pain control cold turkey. And the reason for that is that when we have these pain signals that are going up into the brain, even if they're small pain signals, and if anybody here has ever dealt with chronic pain, you know that over time, these chronic pain signals and these pain signals that just keep going into the spine and going in and throwing into the spine, into the brain, eventually they cause kind of these things that we call hyperalgesia, which means that you have a heightened sense of pain, and then this thing called allodynia. And allodynia can be kind of dangerous in that if there are too many pain signals that just keep going into the spine and into the brain and they just can't stop, the spine and the brain, they start to change. And with allodynia, what happens is that because of neuroplasticity, those kind of receptors, they just start treating any signal that comes in as a painful signal. Now, we see this sometimes with animals that have chronic pain or pain that has not been treated post-operatively. One of the things that I can remember is when I was in my training for a CVPP, we have to write up these case reports. One of the case reports I wrote up was a cat that came into us, and she was in for a pain consult. And it was because the owner had noticed that the cat's demeanor had changed. Now, we know that, again, chronic pain or pain that just keeps coming in to flood the brain is going to cause these changes in personality. You see it with people. We see it with animals. People who are in chronic pain, right? They're just more reactive. They're tense. They're on edge. The same thing happens with these patients, our veterinary patients as well. So this cat had come in. We did an evaluation. And the owner, one thing that they said during the exam that really stuck with me and was kind of a light bulb moment was they said, "I wish we had never got her declawed." Ding, ding, ding. Now, when we go back and we look at the record, again, whatever you feel about declawing, we don't need to talk about that because I have some feelings
First of all,
about it.
it's about dog cancer, and secondly,
that's not a thing.
It's a can of worms, right?
Yeah. Right. So, but when we look at animals who may have had an amputation, which a declaw procedure is an amputation, whether it be a digit amputation or a tail amputation, anytime there's an amputation, that is a lot of nerves that are severed. Right? And if there's not adequate pain control on board post-operatively, those nerves are just going to keep firing and keep firing. And they're going to fire for so long that eventually the spine and the brain is just going to take every signal that comes in and treat it as pain. So by the time that animal got into us, when we touch the animal, just touching the animal's skin causes the animal to react and cower and hiss and be upset. That's because, again, that spine is now thinking that this signal coming in is a painful signal. We see this a lot in Cocker Spaniels that have chronic ear infections, right? That pain just keeps coming and they're not getting any relief. So then when you go to pet the dog on its belly, it reacts and it bites because it's just interpreting all signals as painful signals. So we want to make sure that post-operatively, you are giving the drugs that are assigned to you by your veterinarian. If you feel like your patient or your pet really is back to normal, you're able to touch the incision and the animal doesn't get upset with you, is back to walking around normally, and it's been maybe at least over 3 days from the procedure, then you can have a conversation with your veterinarian about maybe tapering off the dose. But if you're talking about that first 72-hour window after surgery, it is very, very important that we have these pain control modalities and these drugs in place in the body because we don't want to set up kind of this chronic pain or wind-up pain that we call it from even happening.
Wow. That, I'm having light bulb moment after light bulb moment about dogs in my own life whose personalities changed. And I'm thinking, I think I know why Rue kind of changed a little bit. Like I can trace it back. That's very, very helpful. So I know one of the reasons that people don't like to give the pain meds is in part because they seem to sedate the dog a little bit. They're worried about the fact their dog just had cancer, right? Their dog has cancer. They're already worried. The dog has a surgery. That's scary. The dog's awake now, and I want him to be better. I want him to be walking. I want him to be eating. I want him to be, playing again. And the pain meds seem to keep keep them down. So you're saying, that's right, they need that downtime for
That's
72
right.
hours
They do need that
at
downtime.
least. And
Yes.
so even though I really want my dog to be up and bouncing, and if they seem to want to be up and bounce, I want to get them up and bounce because that'll make me feel better, like they're feeling better. It's not worth the risk.
Correct. It's not worth the risk. And I think that this is one of those things that we have to look at. Yes, I want my dog to be up and back to normal and eating and jumping up onto my bed again. But
Yeah.
that's what I want. That's not what's best for the dog. That's what I want, right? So we have to look at kind of what is best for that dog for their healing journey and their recovery from surgery. Because a lot of these animals, especially again, if it's a cancer patient that has had a big amputation or a big abdominal tumor removed, these are big surgeries. These are big major surgeries. If you yourself had a limb amputation or an abdominal surgery, I've had an abdominal surgery. And I remember one day, maybe 2 days after leaving the hospital, being like, oh, I feel great. I'm going to take this laundry downstairs, right? I felt great. Let me tell you, by that evening, oh my gosh, deep in my guts, I could feel that was not the right move. And I should not have done all those stairs carrying a load of laundry. That was not the right move.
Right. And it could set you back in your healing.
100%. Yes. So we want to make sure, again, that not only are our patients getting the pain control that they need, because we want to make sure that everything stays right as far as our pain fibers go, right? Our A fibers, our C fibers going into the spinal cord and the brain, but also, especially if they've had an abdominal procedure or any kind of procedure that has cut through layers of skin and muscle, etc., it's very important that they are a little bit sedate because they need to keep calm. They need to keep quiet. We don't want them popping any stitches open. Again, pain control is usually my foremost. I don't want them feeling any pain, but I also don't want them feeling so good that they're running around the yard chasing after a ball, and then they have to come in and see me because guess what? They popped a bunch of stitches open. Now we're setting back our healing. All of that.
This show is brought to you by dogcancer.com, where over 40 veterinarians, veterinary oncologists, cancer researchers, and science writers pull together to bring you better information today so you have no regrets tomorrow. We do the research, we talk to the folks in the trenches, and sift through the hype and the anecdotes. That's dogcancer.com. Start your own research at dogcancer.com today so you have no regrets tomorrow. Sometimes I know doctors or veterinarians will prescribe pain medications preemptively before a surgery happens. Is that part of this, making sure that that's so fascinating that nerves fire, and the brain starts to think, okay, everything hurts.
Yes.
Basically. Yeah.
Yes.
So is that part of it, why you should give those pain meds before surgery as well?
Yep. Yeah, so it goes into this thing, which we don't need to get too in depth, but if anybody is interested, they can read up on something called gate control theory, right? And that's where the way that these signals go into your brain, if we can get some pain control on board ahead of time, we're just going to increase the threshold that it's going to take for pain to really get severe enough that the body is noticing it, right? So ultimately, if I can give you a little bit of, say, an opioid before I did an incision, right? Or for instance, the doctor is going to give you a bunch of local anesthetic before he takes that tooth out. We want to make sure that we are controlling those pain signals and kind of keeping that threshold for pain high before we get in and we cause kind of that incident during surgery.
Because surgery hurts.
Because surgery hurts. Yes.
Right. No matter what kind of surgery it is, it's hurting.
No matter what kind of surgery it is, no matter what kind of animal you have. Again, we have almost the same physiology as dogs. So if we had an abdominal procedure, cutting through skin, muscle, etc., we know that hurts us. If we do the same thing to our canine friends, we know that they are going to have the similar level of pain, and they need to have their pain treated similarly to us. That's why if you went into the hospital, you would get doses of opioids. When your canine comes into the hospital to see me before a surgery and after a surgery, it's going to get doses of opioids.
Okay, because it's the same. We can assume. Can we assume that? Can we assume that in general, hey, if this was happening to me, that would cause me pain. It's happening to my dog, probably causing them pain.
Yes, we can assume that it's causing a pain. And where we kind of have people say, well, are you sure? It's because most of these animals, right, even dogs, and especially really small dogs, they're still prey species. So if you have, right, if we think about the animal kingdom, and certainly if we go way, way back and look at wolves, yes, they don't have a lot of natural predators, but they still, out in the wild, have this instinct that it's going to be best for them to hide any kind of pain that they have. That's why a dog could have, you guys have probably seen it. You might have an animal that doesn't express that they have a lot of pain, but maybe has a huge abdominal tumor growing. It's not in that animal's best interest to show signs of pain because that is a weakness. Then you're, kind of culled from the herd, etc. So they have this innate kind of drive to not overly show us pain. That's why when we see things like the animal limping or toe touching on a back leg and not willing to put weight on it, when we see that our Labrador goes from always eating breakfast to kind of like laying at the bottom of the stairs, doesn't want to move, not interested in food, if it's gotten that bad, there's something going on. We need to investigate it. We need to investigate what's going on pain-wise with that animal. And, having a veterinary consult is the best thing at that point.
What other signs of pain should people be on the lookout for at home?
Yeah, so there's all kinds of different things, and certainly it does vary from canine to feline. But one of the biggest things is their eating habits. So usually if there's a big change in eating habits, that usually will tip me off. Now, again, I'm a veterinary professional, so if I have a dog that change in eating habits, the first thing I'm doing, right, is like looking at their gum color, feeling their abdomen. Do they react to me touching their abdomen? If they're kind of tender in their abdomen, guess what? We're going to get an ultrasound.
But that's something I can do as a layperson. I can touch my dog's belly and see if they react.
Certainly, yeah. So if you notice your pet is not eating, especially if they are not eating, and then you notice they have a pale gum color, you touch their abdomen and they wince or they react, that one needs to see a veterinarian. We need to get that checked out, right? But things like if they normally sleep in bed with you and they usually jump up into the bed and all of a sudden or over time, you know what, they're not sleeping in bed with you anymore because they just don't want to jump up into the bed. If they're having kind of back pain or any orthopedic pain, they're going to be less likely to go up and down the stairs. They're going to be less likely to jump up in bed with you. Certainly if we have certain breeds that are again more predisposed to kind of orthopedic conditions than others. But if you notice that they just don't want to go on their walks. They're not finding kind of joy in what they did before. They're not chasing after that ball like they did before. Especially for dogs that used to be heavy chewers at one point. If they get away from the rawhide, they don't want to chew anymore. And that could be a sign that they're having some kind of oral or dental pain. So kind of like watching their clues, and you guys know best as their owners, you're with them all the time. So if you call me up and you say, hey, he's not eating, there's something going on or something wrong, we trust that and we want to investigate that further.
Yeah, and it strikes me that like if I have a dental problem, I don't want to chew on that side of my mouth. Same would be true for my dog.
Yes.
If I have trouble, like if I sprained my ankle, I don't want to go for a walk. Same for my dog. Like the cause might be different, but it's, there's something wrong. There's some pain. If you can really tell from their behavior, because they don't speak English and they're not really vocal because of that herd instinct, of that instinct of being, that prey instinct you talked about earlier. Yeah. Okay. All right. That's very helpful. Are there any special considerations for pain management in cancer patients?
Yeah, certainly. So pain management is multifactorial, right? So we could have probably a whole hour-long conversation on just opioids or just drugs, but if we're talking about post-operative and cancer specifically, we're going to talk about drugs, right? But then also we want to talk about, at least I usually will talk about things like nutrition, right? Nutrition is huge. The food that they eat, the type of food they eat, what they're ingesting and how it reacts with their body, et cetera, is huge, especially when it comes to healing. So if your patient, your pet, has just had a major surgery and they are only eating McDonald's French fries, right? The nutritional content is not enough to give the body what it needs to make that tissue more likely to heal. We know that animals that have really good nutrition are going to heal faster from surgery. They're going to be up and around faster. The bonds of the tissue is going to be stronger. So we know that we want good nutrition as well. So that's a big thing. I have kind of conversations with clients because one of the flip side is when we use drugs like opioids and inhalant anesthetics, in that first 24 hours, those animals usually don't want to eat because we know that those drugs can cause nausea, vomiting. But we have some drugs on the market that can combat that nausea and vomiting. So if you're at home post-surgery and your pet does not want to eat, call your veterinarian, right? Don't let it go 2 or 3 days. Call your veterinarian and we can give you drugs that will help to kind of crush the nausea and vomiting feeling. So very similar to what humans get if you ever went to the hospital because you were vomiting and they gave you something called Zofran, but we can give that to dogs as well. We have drugs like Cerenia and ondansetron. So over-the-counter drugs that we can give you, oral drugs that we can give you, not over the counter, over our counter, but we can give oral drugs. So it doesn't have to be always like IV administration. So if you can just get a little meatball with a drug into your pet, then we can give things that are going to kind of quelch that nausea and vomiting. And that's what we want. Because one of the biggest things for tissue healing is I want that patient to get up and eating as soon as possible. Like that's a big thing.
Okay.
And that plays into what drugs I might choose for that patient and why a lot of, when we talk about drug selection in anesthesia nowadays, a lot of our protocols, we try to be opioid sparing. So we try to use the least amount of opioid as possible because we know, and if anybody here has ever had surgery and had an opioid, you know, it just makes you feel kind of queasy and nauseous. Like the last thing you want to do is go eat dinner.
Think about it. Yeah. Opioids are horrible. They make me feel really awful.
Yeah.
Okay, so it sounds to me like just like people don't always like giving the pain meds, sometimes they want to skip those anti-nausea meds that were sent home with them because they think their dog doesn't actually feel nauseous, so they don't need it. But you're saying go ahead and give them.
Oh, yes. I would say definitely give them. Again, unless your pet is back to eating normally. But if they're not, we know that the drugs we have given will cause nausea and vomiting. That is one of the major side effects of opioids and anesthetic drugs. So we have to give something to combat that nausea and vomiting. So please, please, please utilize the drugs that your veterinarian is giving you for nausea and vomiting because we want the pet to be up and eating faster because that is going to increase the likelihood of healing. It's going to speed up healing and tissue recovery, and that's what we want.
How soon do dogs normally want to eat after, if all goes well?
Yeah, so most of the time, I think this is breed dependent as well. If you have, I would say, for the most part, your Labradors, your Golden Retrievers, they're just, they live for food,
they
right?
Wake up hungry.
They just live for dinner.
The gas is off. Do you have anything to eat?
So they live for dinner. I would say that they usually are the ones that will go home and despite being a little nauseous, will still eat their dinner. Most of the time I tell people if they don't eat their dinner after you pick them up that evening, I wouldn't worry too much about it. But by the next day after surgery, I want them back on a regular eating schedule. Now, sometimes that means you might have to entice them with something a little more delicious than they normally get. Please note, I am not saying that we want to go out and get Wendy's hamburgers for your dogs. Again, that's not nutritionally the best choice for them, while it may be delicious for them. We want to make sure, again, that if you're giving your dog something post-surgery, so recovery isn't just like that first 24 hours. Like for some instances, recovery from surgery is going to last weeks or even months, especially if we talk about certain orthopedic conditions. Or for some dogs, losing a limb, right? Then they might have to go to rehabilitation therapy. They might have to go to kind of acupuncture, massage therapy, which again is not specifically drug related, but one of the therapeutic modalities that can help with postoperative pain management, recovery, and healing.
Hoping for a regular dose of hope along with the latest information on dog cancer? Subscribe to our email newsletter, Dog Cancer News, at dogcancernews.com. Each week, we send support, guidance, hope, and information via email to dog lovers just like you. We know what it's like to have a dog with cancer. So join us and subscribe to Dog Cancer News at dogcancernews.com.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.